morning. My name is Dr. Robert, and I'm here with the panel to be addressing human healthcare as a human right as it pertains to children and women. And with the two team members in my panel, Jennifer Leslie to my right and Dr. Catherine Tecum to my left. Jennifer Leslie is a graduate of Florida International University with a Bachelor of Science degree in nursing and a Master's of Public Health Policy Management. She is also a graduate of University of Miami School of Law with Juris Doctor degree. Dr. Catherine Tecum, to my left, received her doctorate degree of nursing from the University of Miami. She is a Senate Health Advisor for District 38. Thank you.
Good morning, everyone. Good morning. Thank you for coming and welcome to the Healthcare Summit. If anyone in this room has ever visited a hospital here in the United States of America, let me see your hands. Awesome. Me too. I also gave birth to my daughter at a London hospital, and I worked at a London hospital. Since then, I have been in healthcare, not only in Florida, but in also several other states. That in itself gives me the right and qualifies me to talk about healthcare as a human right today. That's not all though. I worked for some 30-something years in the healthcare field. And I have seen it all. I am sick and tired of being sick and tired. And I have decided to do something. Yes, I'm going to do something. Starting right here and starting right now. You see, I care about the sick. I care about the elderly, children, and women. That is why I advocate for health care. And that is why I led my Health Task Force team to research, propose, draft, and file a legislative care bill on behalf of all family caregivers throughout the state of Florida. Now, women are primarily family caregivers. Family care at home especially falls on the backs of women. Women tend to have to quit their jobs, stay at home to take care of a sick family member. And guess what? It leads them into poverty. So, tell me, who here knows what is going to happen to their parents? Do you know who is going to take care of your parents? How about your grandparents? Your great-grandparents? Do you know? My mother, when she was alive, she became sick at first and disabled. Prior to that, she had worked for many years in the United States. When she became disabled, I was forced, as the only girl, to stay at home just to take care of my mother. Well, my mother was really mentally intact. So guess what? Behind our backs, she booked a flight and off she went to the United Kingdom, just so she could have full access to health care, just so she could get full care. I was so helpless. I felt powerless. I cried, and I cried, and I cried. And after that, my mom died. Within a year or so, she died from cancer. Regretfully, I was not there at my mom's bedside. I lost the ability to be at my mother's bedside just because she had to leave America to go to another country for health care. I did not see my mother when she died. I will never forgive myself. My task force, my health task force, has done something about that. I've led my task force to file a Senate Bill 1786. This bill, and the goal of this bill, is to provide family care givers many opportunities that they would not otherwise have, hence placing them in a better financial position. So far, Senator Daphne Campbell has been supporting this bill. In fact, she helped to file it for us. But this bill cannot pass without the full support of both the House and the Senate. So I am urging every senator, I am urging every state house representative to support this bill, Senate Bill 1786. And I'm also asking each and every person in this room, find out who your state house representative is, find out who your senator is. Call them and ask them to support Senate Bill 1786. I am going to conclude by saying, I am not here to tell you or to convince you to make healthcare universal. We want healthcare to be a human right. And we need to start, whatever we need to start doing, we need to start doing it now. But there's one thing I must tell you in conclusion. Your families will not prosper until healthcare becomes a God-given human right. Yes, I cried, but I will cry no more. But I am going to do everything within my power to fix this mess. And I am going to make healthcare a human right. In doing that, I am going to fight like hell, did you hear me? To make healthcare a human right. God bless and thank you.